Today, I'm going to talk on this, I'm going to present on this particular topic, that is COVID-19 antibody testing, how to use it in simplified manner. So we all know that when the one person is infected with the COVID-19, the concerned antibodies would be produced in their body. But by doing this test, how to interpret the results is the most important thing now. To throw some light on this particular aspect, today, I'm going to present on this particular topic. Uh, yeah. Yes, the role of antibody testing for COVID-19 infection. The first one to remember in this list is this is to support the clinical assessment of COVID-19 illness. So once the person is suffering with the COVID-19 infection, to assess clinically whether they are in acute phase or in the recovery phase or in the protected phase, to all this to understand, we have to do this IgM antibody testing. And number two is to establish the complications of COVID-19 illness. The COVID-19 illness not only associated with either recovery from the infection or losing the patient, but it's also associated with the complications in the form of clots, especially in the brain and other areas of the body. To know these particular complications, also we can go for the levels of IgM and IgG antibodies. So the multi-system inflammatory syndrome will be identified post-COVID infection based on this IgG, IgM antibody testing. And third important point is for the serosurveillance. Serosurveillance means the proportion of population exposed to the COVID-19 infection. Among the total population, how many people have been exposed, and to some extent to produce the herd immunity, also, this would be to understand the level of herd immunity also, it would be useful. So for the surveillance purpose also, we can do this particular IgM IgG antibody testing. And the first, before going to the antibody testing, we should understand what are the antigenic targets on COVID-19 for which the antibodies are going to be detected by serological testing. The first one is the spike protein. So here you can see the spike protein here. This is the spike protein. And in this spike protein, you all know that the importance of this spike protein. It's essential for the virus entry into the cell. It enters into the cell and gets attached to the ACE2 receptors to this spike proteins. And number two is we are going to demonstrate the antibodies against nucleocapsid phosphoprotein, that is also known as N protein. So the antibodies produced against the S protein and N protein will be detected, and this N antigen or N protein is useful in the viral assembly and assist in RNA synthesis, and also plays a role in viral budding, and it affects the host cell response also. It affects the host cell response also. So the antibodies produced against this particular two antigens will be detected. Now, what the types of COVID-19 antibodies are produced? As we all know that we know only one type of antibodies, those are binding antibodies. These binding antibodies are produced in the form of IgM and IgG, and this type of antibodies will be produced. And another variety of antibodies are neutralizing antibodies. These are all subgroup of antibodies that may inactivate the virus. That means the antibodies which are produced, either IgM or IgG, are they effective to neutralize the viruses or not, is the most important criteria to get protection against this particular viral infection. The antibodies which are produced are not able to neutralize the viruses enter into the body, then there won't be any use. But unfortunately, we didn't get the kits to detect the neutralizing antibodies, not approved by the FDA still. One is acceptable methods for testing. Why I'm talking on this is some people are using the rapid methods also. rapid methods also being used, and these rapid methods are not to be used to identify or to detect the COVID-19 antibodies. We have to go for only quantitative method, that is either by ELISA method or little more sensitive methods, the CLIA, that is chemiluminescence immunohistochemistry method has to be done. And other methods to detect the neutralizing antibodies, these tests are not been approved by the FDA from US. And so when to do this antibody testing for COVID-19? This is very important aspect to learn. Without knowing when to do this particular test, there won't be any use. And one more thing is there would be a lot of problems in while interpreting the results also. So the first one to be understand in this particular aspect is symptomatic case which was not tested. A symptomatic case which was not tested for antigen previously, these people have to be subjected for antibody testing. And number two is previously positive case undergoing for the medical procedure now. So if you want to do any medical procedure on any person or any patient who was previously positive, for them to understand whether really protected from antibodies or not, we have to go for this. And third one is recovered individuals who want to donate plasma to the sufferers. So these three types of individuals have to be subjected for antibody testing. And then we will see the antibodies production and their presence and their relation to the symptomatology of COVID-19 infection. So if you see after an infection, see here, after an infection, after 7 to 14 days, or depending on, because now we are giving the more incubation period, that's around 14 days. So from after an incubation period, the IgM starts producing, and with the onset of symptoms, on 7th day of the onset of symptoms, see, this is on the 7th day of onset of symptoms, you can see high quantities of IgM antibodies are produced. So from the 0 day after the symptoms onset, you can see the IgM antibodies, and reaches the peak to the first at the end of the first week. So at the end of the first week, the IgG starts producing, and you can see the maximum number of IgG antibodies by 14 to 21 days. By 14 to 21 days, you can detect the enough number of IgG antibodies from the patient serum. And if you see these IgM antibodies, will disappear by the 14 days, and of course start declining 14 days, and by almost 20-21 days they disappear. And then the IgG antibodies which are produced from the end of the first week, they will be continued for further few months. And still there are some doubts are there how long these antibodies would be present in the blood. Some people are saying that, or some articles are saying that they would be present in the blood for about 3 to 4 months, and some people are talking about 6 months. Still it has to be confirmed. And after that, if the person recovered from this particular episode because of the presence of IgG antibodies, the antibodies will be produced, and the second episode also possible. When the second infection is possible after few months, again the short rise of IgM antibodies you can observe, and the high rise of IgG antibodies. So these IgG antibodies will be produced again due to the presence of memory T lymphocytes. The memory T lymphocytes are responsible for a high rise. So with this you can understand that with the presence of both IgM, IgG, most of the times we can say that that would be an acute phase of infection. And if you see only the IgG antibodies without the IgM, then we can say that that would be a phase of recovery. Or the phase of protection period. So this is how the antibodies will be produced and present in the blood. So in the first week of illness, you can see high titers of IgM antibodies, and the second week of illness you can see the high titers of IgG antibodies. And the important feature what we have to understand here is how to interpret this results, IgM presence or absence of IgM, and presence or absence of IgG, and presence of both IgM IgG have to be interpreted appropriately for the proper diagnosis. Now, interpretation of these results with the presence of RT-PCR, with the presence of RT-PCR. Say for example, if the person is positive for RT-PCR test, in this particular individual only IgM is positive, then we have to consider that would be an acute phase of infection. That would be 7 to 10 days of infection or illness. And only IgG is positive, then infection would be more than 14 days. Infection would be more than 14 days when along with the positive RT-PCR testing. And if both IgM and IgG are positive, this indicates acute phase with a good prognosis. So when the person is positive for RT-PCR, and if you are able to identify the IgM antibodies only, then that would be acute phase. If IgG only present, infection would be more than 14 days. If both IgM and IgG present, acute phase with good prognosis. Why? Because already the IgG antibodies are formed and detectable levels are present. Next one is if the RT-PCR is negative. If RT-PCR is negative and only IgM is positive, then it would be acute phase, more than 7 days. And in this case, always you have to go for repeat RT-PCR testing. Repeat RT-PCR testing is required now. And if only IgG is positive, that indicates past infection. RT-PCR is negative and only IgG are present, then that would be a past infection for which already he got some protection. And if both IgM and IgG are positive in the absence of RT-PCR test and they are in the presence of RT-PCR negative testing, that it indicates acute phase of infection which would be more than 14 days. This is how we can combine perfectly with the RT-PCR to interpret the antibody testing. Then, what are the risks associated with antibody testing? And the first one is the test may not be accurate always. Remember, this is not always accurate. False positives also possible and false negatives also possible. When the false positives are possible, when the individuals are infected with other than COVID-19 coronaviruses. See, the coronavirus or COVID-19 is responsible for severe acute respiratory distress syndrome apart from other clots in various parts of the body. But other members of the coronaviruses, and especially alpha coronaviruses and other coronaviruses causes for simple common cold. So some common cold producing these adenoviruses also will give false positives. Next, false negatives are possible if you collect the serum or blood or plasma for testing very soon after infection. In early stage, that means before the 5 days or 6 days of the after the infection or illness, and that test would be would give negative, which can considered as false negatives. Even positive test, even though the test is positive, there is no guarantee either for protection or they can get reinfection. So these are the problems associated with the antibody testing. Remember, it is not always accurate. It may cause for false positives due to other coronavirus infections in the form of common cold, and false negatives possible if you take the sample before 5 days or maximum 7 days of the illness. And even positive test is not the guarantee. So even though only IgG are present, it's not guaranteed that whether you are going to get protection or you may undergo for the reinfection with this virus. And then conclusions about this antibody testing. The positive test should not assume the protection, because there are a lot of queries are there related to the level of protection being produced by the IgG antibodies, and there is a big query about the duration of immunity produced by these particular antibodies. So for this, what we have to understand is the neutralizing capacity of these antibodies. To assess the neutralizing capacity of antibodies is very, very important. Unless you do this neutralization test, it's very difficult to assess the how best these antibodies can kill the viruses once they enter into the body. And another thing is, in spite of the positive test, we have to continue with the sanitizer, mask, and social distancing. And another important point to remember in this aspect is detection of memory T cells is the best to know the immunity. Detection of memory T lymphocytes is the best to know the immunity, followed by the second episode of our reinfection with this COVID-19. These memory T lymphocytes are responsible for the production of large number of IgG antibodies or the protective antibodies to fight against the T lymphocytes. So this what I would like to finally conclude is this antibody testing is one aspect, and the antibodies, how best they can give protection, is another aspect. So if you see the how best they can produce the protection, that we can't tell unless we do the neutralization test. So in the neutralization test, what we do is we will take the plasma, serum, or blood sample. That would be that would be incubated with the infected viral cells, and based on that, how best they can kill the viruses will be assessed. So based on that only we can say that how best the antibodies can give protection. And antibody testing is different. So this antibody testing also will give some clue about the diagnosis and the phase of infection and the level of protection being offered by the infection with this COVID-19 virus. And this is about the little queries I would like to, some of the queries I would like to clarify based on the IgM and IgG antibodies being produced and their utility in the diagnosis of this particular viral infection. And thank you very much.